The following segment is sponsored by Intermountain Healthcare. Intermountain Healthcare's primary promise to create a national model health system for children is already making a difference in kids' lives. Thanks to a generous community, Katy Welkie is the Chief Executive Officer of Intermountain Primary Children's Hospital and the Vice President of Intermountain Children's Health, and Dr. Lisa Giles of University of Utah Health is the Medical Director of Behavioral Health for Intermountain Primary Children's Hospital. They are here to tell us all about this promise. Welcome to the show, ladies. Thank you so much for joining us today.
Thank you for having us.
Absolutely. I want to talk about the primary promise. So for those who aren't familiar with it, what is this?
So the primary promise is a multi-piece initiative, and it's really intended to create a healthier Utah, a healthier Intermountain West for our kids, and really thinking about the programs that are necessary, the buildings that are necessary, the people that are necessary to really transform healthcare for kids.
Amazing. And how great is the need for behavioral health services for these kids?
So it's probably no surprise to anyone, the need is great, right? We continue to see growing needs of, youth for depression and anxiety and so forth. Unfortunately, suicide continues to be the leading cause of death for kids in our state. And I think it just continues to speak to the need is there, the need is great.
Absolutely.
And when we went out to the public and talked about the different areas, so we're working on research, we're working on things with neonates, the piece that kept coming up, the subject that kept coming up was behavioral health. Are you investing enough in behavioral health? And our community really knows that that need is there.
That's amazing. Well, in addition to behavioral health supports, Primary Promises made also other services and innovations possible. And let's talk about what some of those are.
Yeah, there's incredible work being done in our fetal center. So being able to care for babies and actually do surgery while babies are still in the womb. We're doing research. We're building a new facility in Lehigh, the Miller Family Campus, that's going to bring care closer to home. And all of those things are important. So addressing our tertiary quaternary care children's hospital, extending care to a broader area of need and broader geographic care for children, and then really thinking about emerging health needs like behavioral health.
Wow, so many exciting, innovative things going on. How is the Primary Promise also looking to address food insecurity and maybe past traumatic events?
I'll talk about food insecurity, and then maybe you can talk about past events. We're actually opening a food pharmacy at Primary Children's where patients that are coming in can come and get their food needs met, and then have referrals into other food banks that'll be really, really helpful.
Wow.
And then we're working with our pediatricians throughout the entire community to do screening for social determinants, because you have to know that there's a need in order to connect people to the right resources.
Absolutely, that's such a good point.
Yeah, and then certainly just feeding off that in terms of, past traumatic events. We know, that so much of kind of what kids are exposed to very early in life, it has such a difference moving forward, and so helping our pediatricians be able to screen for that and address that and recognize really early on when there are challenging circumstances going on in the home, and then how do we intervene early to be able to make a difference.
Sure.
Because we do know that if you're able to identify those events early and that kids are having stress, there's evidence-based treatment that provides the relief that kids need to really, really help them for the rest of their lives.
Wow. Well, it's been so great having you ladies on, so informative. Thank you. And as always, we just so appreciate having you on.
Thank you.
Our pleasure.